to the Fibroid Foundation's Fibroid Awareness Month 2026 session on patient voices in fibroid research. We are so pleased that you have joined us for this Patient-Centered Outcomes Research Institute funded convening on uterine fibroid treatment options. PCORI, which is the acronym for the Patient-Centered Outcomes Research Institute, funds research that compares healthcare approaches to determine which works best for whom and under what circumstances. PCORI's mission is patient-centered, which is key. They've been pivotal in our research story as an organization, and they receive community input to determine what gets studied next. This is not a general awareness event, but instead a targeted effort to share findings from the Compare UF Fibroid study so that patients and stakeholders can understand the evidence and help shape future research priorities. During the Compare UF study, the Fibroid Foundation had the honor of being on the registry steering committee. And one of the key investigators was Dr. Kedra Wallace, who is joining us today. It was such an honor for us to be a part of this study. It was the first time as an organization that we had contributed to the actual design of a patient-centered study and helped to contribute thought and life experiences to the actual study papers and outcomes, which was transformative. And so at this time, I'd like to introduce Dr. Wallace. Dr. Kedra Wallace is a neuroscientist who believes empowerment through knowledge is key to closing the gap in gender inequalities. Her research focuses on the role of hypertension and inflammation during pregnancy and the relationship between postpartum depression and anxiety. Her lab also studies the relationship between health literacy, healthcare access, and mental health among women affected by uterine fibroids. Welcome, Dr. Wallace.
Thank you. I'm so honored to be here, and I'm really excited about the investment that PCORI has made into your foundation. And I think that this is just going to continue to open the doors and avenues for increased literacy and awareness among so many women and their partners. I'm going to share my screen. So I don't have any disclosures, and as Satiri stated, I'm going to review the Compare UF study, which was really a foundational study. It meant so much to me for so many reasons, one of which is that this was one of the first major studies that included women in the South with uterine fibroids. So as you can see on this slide, these are all of the recruiting sites for Compare UF. This is my hospital here, University of Mississippi Medical Center, which is in Jackson, Mississippi. And there were some ancillary sites associated with the Mayo Clinic that were in Florida. But really, for the bulk of the study, anyone coming from the South, from the Deep South, I should say, was really centered here. And so again, just having this representation, I think is crucial to really understanding uterine fibroids and how it impacts women, their support systems, and just life in general. So this grant was funded through PCORI and AHRQ with $20 million, a very generous investment. And due to COVID, it was extended through 2023, but we actually stopped recruiting women in 2019. So this was a registry study. So what's important about that is that we just wanted to know what women's experiences were. We had nothing to do with influencing their surgical choice or their procedure choice. It was really about wanting to know, this is your procedure. Let us ask you questions from the time you get your procedure to 1 to 3 years following that procedure, just really to evaluate your quality of life. If women were looking to get pregnant, we also asked questions about that. If they were getting close to menopause, so we just had a whole variety of things that we were really looking at. So all down here, these are all the recruiting centers. And then we had Duke, which was our data coordinating center. So we really didn't recruit anyone from there, but they were responsible for really just making sure that all the data that we collected was collected and managed in a very, I would say, very standard way so that all the results really could be shared. And then we had the Fibroid Foundation, which really, I like to say, kept us honest, made sure that as researchers, we weren't asking and investigating what we were interested in, but we were asking and investigating what patients said that they needed and wanted to know, which I think was absolutely crucial to the study. So just, and I think I probably am preaching to the choir here, but I like to always throw a little bit of education in just because I know that with my own patients and women that we work with, sometimes these are points of confusion. But we looked at almost all procedures that were used for uterine fibroids. For hysterectomy and myomectomy, there were different routes. So whether it was hysteroscopy or laparoscopy, I didn't show abdominal. Abdominal is exactly kind of what it sounds like. It's when the abdomen is cut open and the fibroid is removed that way. Uterine artery embolization, as well as we collected data for women who had an intrauterine device. So what exactly was it that we did, that we collected, and that we wanted to know? So we talked to women before their procedure, shortly after their procedure, 6 to 12 weeks after their procedure, and once a year. So the year started a year after their procedure. So we collected their sociodemographic information. This included their race, how old they were when they started their period, how long they've been experiencing uterine fibroid symptoms, when they were diagnosed with uterine fibroids. Really, we just try to get really in-depth into collecting all of that information, as well as income information, household. We collected pregnancy history, what, if the pregnancies were successful or not, and those outcomes, as well as just data about, do you have hypertension? Do you have diabetes? We collected all of that type of information. We also wanted to know, what has your journey been like as far as any medical procedures? Have you had uterine fibroid procedures before? Have you been on different medicines for uterine fibroids? What are you currently taking? So we collected all that information as well. We also collected images of their uterine fibroids so that we could evaluate the size, the number, the location. So all of that information was collected. And then my favorite part was really when we asked the questions about, what is your quality of life? How are uterine fibroids impacting your everyday life? So we used a number of validated surveys to collect this information. And these surveys were used across all the sites. So again, so everyone was asking the same questions all the time. But really, the overall goal was to be able to take all of these factors from women all over the country and really understand if any of these factors impacted their outcomes with their procedure. So for instance, women who chose to have a myomectomy. So were there differences between their route? And if there were, was this race dependent? Was this age dependent? Did it depend on where they live? So those were all the types of questions that we hope to be able to ask and answer. So again, just the goal that we had is at the end of the study, we would have collected enough data, had disseminated it so that women will now have more information to help them make informed decisions regarding their treatment options. So overall in the study, we had a little bit over 3,000 women that were registered. And again, please keep in mind that depending on when they joined the study, we may have been able to follow them for 1 year, 2 years, or 3 years. So I'm going to go over just a couple of the major findings that we found from Compare US. So one was really looking at the long-term health-related quality of life. And so in this study, we really wanted to see the quality of life change, and did your symptom severities change? And again, keep in mind, these are all self-reported. So to do this, we looked at women who had a myomectomy, and if they had it abdominal versus laparoscopic, and the same with hysterectomy. So we wanted to know if hysterectomy, if it was abdominal versus laparoscopic, and then we compared also women who had a uterine artery embolization. So in order to qualify for this part of the study, we needed women to have been in the study for at least 3 years past their surgical date. So when we looked at that, we had about 1,400 participants. And so what we found was that at year one, everyone had improved quality of life. So the quality of life improved, or it didn't matter what type of surgery you had. And same with the symptom severity. As to be expected, women with a hysterectomy and the laparoscopic hysterectomy, they had the most improvement overall. So again, this was really true because their symptom severity was very much improved because with your hysterectomy, now you're removing the source or the major source of all the bleeding. By 2 years, there was still continued improvement in quality of life and the symptom severity. And the women who had a laparoscopic hysterectomy were still reporting the most improvement. By 3 years, same thing, continued improvement in your quality of life and the symptom severities. But now it didn't matter the route of your hysterectomy, women were still reporting the most improvements. So one thing to note, which was unique about this Compare UF study, was that we capped hysterectomies at 20% of enrollment. And the reason for that is because we also wanted to make sure that we were not overpopulating our study population with women who had a hysterectomy. So as expected, their symptom severity symptoms would decrease over time. And also, they would no longer be able to help inform or give us enough power to have informed decisions about any reproductive outcome. So the second study that I'm going to highlight is looked at the route of myomectomy and fertility. And really, this just wanted to know is, does the type of myomectomy you have impact your fertility? We had about 1,100 women who qualified for this study. And again, we looked at 3 years after surgery. And what we found was that it didn't matter what type of myomectomy you had. It had no influence at all on your pregnancy success. And this was found after we controlled for women's age and women's race. So that means that when we did our model and we said, okay, if we just ignore race and if we ignore the age, do we still see these differences? And so what we found was that there was not this impact with your route for myomectomy. And so another study we did was to look at anxiety and depression and quality of life after your interventions for uterine fibroids. So with this, we looked at women 1 year after their procedure. So we looked at any type of intervention, it didn't matter. And we had about 1,500 participants in this. And what we saw was that anxiety and depression, it decreased in most women. Quality of life improved in most women. It didn't matter the procedure. So the procedure was not really dependent on whether or not your quality of life improved or among the women who had this decrease in anxiety and depression. But what we did find was that about 5.6% of women had increased anxiety and depression. So when we looked at the different factors, there were nothing that just really stood out among these women to indicate why they may have had an increase in anxiety and depression. So overall, from the studies to date, one of the most important things that we found is that the patient-specific factors are important. So I mentioned before that when we collapsed the results, that's when we saw that your myomectomy route, it didn't matter. So if you compare all your Black women who had a myomectomy abdominal and a myomectomy hysteroctomy, if I can say it, then there were no differences. But what we were not able to tease out, but what we did see is that when you start combining race and age and maybe financial levels and maybe just other different demographics, then that really influenced the outcome. So as you would expect, if a patient has hypertension, then that would influence their pregnancy outcomes or maybe how well their symptom severities are. So these are just really things that we thought were very important, and that really now I think the big goal is really just to help emphasize to patients to really talk about these with your physician, with your doctor, whoever you're talking with about this, just to really make sure that your care is specific to you, but also with knowing that certain things, when we look at them at a big picture, are not going to influence the outcome. So I would like to thank everybody. These are all of my collaborators on the Compare US. This was definitely a huge village, a huge network, and it was a joy to work with everybody. And thank you.
Thank you, Dr. Wallace. That was very informative, and I look forward to your input during the question and answer session. At this time, I'm going to introduce Congresswoman Underwood. Congresswoman Lauren Underwood serves Illinois' 14th Congressional District and was first sworn into Congress in 2019. She's the first woman, the first person of color, and the first millennial to represent her community in Congress. Rep. Underwood is a registered nurse and co-founder and co-chair of the Black Maternal Health Caucus, which addresses America's Black maternal health crisis in Congress and advances policy solutions to improve maternal health outcomes and end disparities. Rep. Underwood is also the co-chair of the House Democratic Policy and Communications Committee and serves on the House Committee on Appropriations. And prior to her election to Congress, she served as a senior advisor to the U.S. Department of Health and Human Services. As a career public servant at HHS, she also helped implement the Affordable Care Act. Welcome, Congresswoman Underwood.
Hi, Soteria. Thank you so much. I'm so delighted to be here with you and to hear Dr. Wallace's presentation of her research findings. I'm excited to be part of this conversation because I bring several different perspectives to the topic of fibroids and living with fibroids. I've been a patient, I'm a nurse, and I'm a policymaker. As a patient, I was diagnosed with some fibroids in 2021. I was, I believe, 34 years old, so 5 years ago, and at the time was severely anemic. It was during the pandemic, had not necessarily been going to the doctor during the pandemic, so these were quite large, and we found ourselves in a pretty significant situation. And so I spent the late summer and fall getting healthy enough for surgery, and then had an open abdominal myomectomy where they removed two grapefruit-sized fibroids, and had a pretty significant recovery period. I got to tell you all, I was shocked that my poor little uterus was breaking news in this country when we sent out the press release that I would be having the surgery and out for a 6 week recovery period. And, you know, a lot of my colleagues, a lot of reporters, a lot of folks throughout my community were not familiar with what a uterine fibroid was. And so we had to do a lot of education during that recovery period. Ultimately, you know, the surgery, I think, was successful, but not a cure. And so, you know, this is something that I've had to learn to manage and live with in the years since. I think that, you know, this kind of investment from PCORI into understanding the lived experiences of Black women, and particularly the regional dynamics, and choices that they may be given is very important. Because as a registered nurse, I know that the care that we provide is only as good as the research that's done, and there's some serious gaps in women's health research. I mean, we know on this call that women were not required to be included in clinical trials until 1993. And so we are still working hard to make sure that the full experiences of women are reflected in our research studies. That means pregnant women, lactating women, and as a result, we've really been playing catch up for years on drug development and medical education and public health campaigns and the like. And so we know that this research is woefully underfunded. Fibroids has been an area that has just been, you know, glossed over for too long. And to me, that represents a real policy choice. And so I believe that this issue is one that's worth investing in. And that's why I've been so proud and pleased to be a co-sponsor of important legislation like the Uterine Fibroid Intervention and Gynecological Health Treatment Act, also known as EUIITE, and the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. Both of these bills would require the U.S. Department of Health and Human Services to expand research on uterine fibroids, to educate the public and healthcare providers, provide grants to increase early detection and treatment, and more. And then I think more generally, we have to be serious about investing in women's health, which includes maternal health, and ending disparities that we see impacting Black moms in particular when it comes to maternal mortality. And so that's why I've been so proud to lead the Black Maternal Health Caucus and to be the lead sponsor of the Momnibus, the comprehensive legislation to end preventable maternal death and save moms' lives. So ultimately, I know that as a representative in Congress, we have to actually provide representation. And when it comes to fibroid awareness, I'm not the only member who has been outspoken about our personal experiences. This is not in the Congress a phenomenon that's limited to the Black women also. I know a number of my colleagues who are not Black women who have, personal current uh, experiences, challenges with serving and taking care of themselves while they have these fibroids. And I hope that by working together, we can make sure that more research studies get funded, that we can build on Dr. Wallace's findings, and support more women along their journey. So thank you for having me and for your commitment and the resources of the Fibroid Foundation to improve care for women everywhere. Thank you.
Thank you so much, Congresswoman Underwood. Thank you for sharing your story, and thank you for all of your leadership. It's just so important. And I know we're moving to Q&A after we hear from our amazing patients, but I just would like to bookmark some of the statistics that you shared and Dr. Wallace shared, which is that 70 to 80% of all women, regardless of ethnicity, will develop uterine fibroids by age 50. And there was a recent study within the past year that revealed that 47% of Asian women have uterine fibroids. So the Fibroid Foundation has recently received some outreach from some periodicals and journalists based in Asia. And so I wanted to really just kind of highlight that to show how pervasive uterine fibroids are. At this time, I'm going to move to our first patient, Catherine Hanna, who will share her story. Catherine, welcome.
Thank you. So where do I begin? I'm a little nervous, but I will just speak from personal experience and what I've lived and what I'm still currently living with. I struggled and suffered with fibroids long before I even knew what fibroids were. I'd never heard of fibroids. So I started my menstrual cycle at an older age, like right before I went to college. So I was away at university. I went to school in Boston, and I was missing classes, missing activities, canceling social events and gatherings with friends because I just had extremely heavy periods where I felt like I would faint. I went to the doctors multiple times. This is what I'm feeling. This is what I'm going through. Well, it's okay. Your period is just heavy. You just have a heavier cycle. It wasn't until years later when I was graduating and I had a clot fall out, a massive clot, and I panicked. I'd never seen anything like that. Then we found out I had fibroids. The next course of action was to go on birth control and wait and see. And it was just so scary to me because I said, what are fibroids? What's going to happen to me? And I had so many questions. And my only answer really was, we're going to wait and see. Come back in 6 months. We'll do another ultrasound and see. And of course, maybe 3 years later, I had more fibroids. My symptoms were worse. I actually had to stop working for a while on and off. And I had my first surgery. Since then, I've had 3 laparoscopies. I think that's how you pronounce it. And most recently, about 2.5 years ago, I had a myomectomy, a robotic myomectomy. And I had multiple fibroids, and one was about 10 centimeters, I believe they said. I had no clue that I had one that large until I just had my baby. back in February. So it's been a long journey. I had an IUD after my robotic myomectomy. I kept it in place because my goal, as we mentioned before, was to have a family. I wanted to have a baby. It's my dream. I want to be a mother. What can I do to make sure that I have a high chance of maintaining my fertility, having, hopefully easy pregnancy? And my doctor told me that procedure would, be a good option for me, because of the size of the fibroids and my end goal. But I would have to have a C-section. Now, I got pregnant. I explained to my new doctor.
Okay.
No one explained what pregnancy would look like should I get pregnant. And my doctors had told me before, well, you have some time to go. You're young. Don't worry. It's not about your age. It's what my goal was as a patient and being heard and understanding my body, what pregnancy could be like. So I'd never heard of placenta previa, placenta accreta, increta, procreta. Um, Ended up having placenta previa, complete previa. Somehow that corrected. And then I was told, no, you have placenta accreta. And I was in and out of the hospital. So I was just learning all of these new things about my body. Was this related to my fibroids or not? I had no clue. So I'm no doctor, but I write down my questions and I continue to ask and I look for answers. Luckily, I gave birth to my baby. I did not have placenta accreta based on the pathology report, but I did learn having these types of surgeries for fibroids can increase these risks. So, more awareness about that, I think, is important. Asking more questions, being okay with not sticking with one doctor is what I've also learned. Ask a million questions. If you're not comfortable with your doctor, if something's not clear, or they're telling you hysterectomy, because I've heard that too, don't do it if that's not what you want. There are always options to explore, and I'm very happy to share my story. So here I am today with my baby, and I do have 3 new fibroids. So journey continues, right?
The journey does
Yeah,
continue, and thank you for sharing your story,
my
Catherine.
pleasure.
All of the details, I'm sure that our community will find tremendously helpful, and I applaud you for advocating for yourself. That is key.
Thank you. And thanks for having me.
Of course. And so I'd like to next introduce Natasha Rao, who is a patient sharing her fibroid story as well. Welcome, Natasha. Thank you for being here.
Thank you so much for having me. I want to start by sharing that my husband is in the military. So when I started experiencing my fibroid journey, I was in Manila, Philippines. So I was experiencing heavy, heavy, heavy bleeding. There weren't sanitary products that were working to help with my heavy bleeding. I want to share that because it was very stressful for me to find something that worked because I was working and those weren't working for me. So I was going to the embassy clinic. Thankfully, it's available at the embassy where I worked, but it was still stressful because every day I was going and trying to figure out what was causing this, and no one could figure it out. I went to doctors and nurses at the embassy. Then they proceeded to send me outside of the embassy to Filipino doctors who finally decided to do an ultrasound and noticed that it was fibroids. Interestingly enough, my fibroids weren't huge, but they were in a place, I guess, that was affecting me and making it so I was bleeding so heavily. So I had to get medevaced to Singapore to go and have my fibroids removed. They were all against me getting a hysterectomy. I found it interesting that no one shared any reason why they didn't want me to get the hysterectomy. They just said I was too young. I was around 36-ish. And I was just like, why aren't they educating me and telling me why they don't want me to get the hysterectomy? They were just all definitely against it. So I went to Singapore. They removed my hysterectomy. They removed my fibroids, and then they added the IUD, which I found kind of interesting because after they did this procedure, yes, my periods got lighter, but I didn't know if it was because they removed the fibroids or because they added the IUD. So I found that interesting that maybe that's not something to do at the same time because we don't know what's actually helped. Then I moved to Tucson, Arizona, where I had a doctor who I went to and shared my story and made sure she understood that I had the fibroids, I had them removed, but we needed to still kind of track them. So we would do ultrasounds. Everything was fine. Everything was looking good. I thought that I was, fibroid free. And then recently, last year, I had another doctor. I'm now in the DC area and still keeping up with my ultrasounds. They do them every year to 2 years. But last year they checked, and once again, I was told that I had fibroids coming back. Not large, but I found it also interesting because we've been tracking with my IUD. My period hasn't stopped. It's light, but it still goes for about 3 weeks. So with that, we've tried changing the IUD, and that wasn't helping either. So then it was interesting that all of a sudden, probably wasn't all of a sudden, but all of a sudden it's showing up that my fibroids have returned in my ultrasound. This time around, my new doctors in the DC area recommended my use of green tea extract and vitamin D plus K2 to help it from growing. And so that would be something to be an option instead of a hysterectomy once again. So I have been doing that recently, but you can't really tell if that's working yet until I do another ultrasound. So I'm waiting for that 6 months down the line. But as a military spouse, again, I am moving into Australia. So I've been looking to see if there are fibroid specialists that I can have supporting me out there, because this is something that I keep having to deal with and I want to have the support I need out there. So in a nutshell, I've been dealing with bleeding, heavy bleeding initially, and then just prolonged bleeding since 36, and I'm now 44, and all due to fibroids. And I've tried everything from diets, exercises, meeting with doctors about this, and my family history I have to share as well. My cousin and my mom both had hysterectomies and said it was the best thing that happened for them. So I'm pushing it out, but I think that hysterectomy might be the best option for me. So I'm not bleeding until my 60s like my aunt. So yeah, in a nutshell, that's my story.
Natasha, thank you so much for sharing your story. And I'm so sorry for you and Catherine having to endure what so many women, including myself and Rep. Underwood, have had to endure as well. And um, please rest assured that your life experiences mean a lot, and they provide a lot of insight and will help us to uncover the answers that we need to address this massive health concern. So thank you for that. I'd also like to point out, thank you for mentioning that you are a military spouse, because oftentimes when we think about research in the military arena, we think about active duty military members. But after attending the Military Health Research Conference, we learned that I think it's almost 90% of military spouses are female. And so that's a huge population that also needs to be considered for screening pre-deployment and for support like you needed when you are deployed. So I just wanted to mention that. So now I'd like to move into the question and answer session that we have, and welcome all of you to participate. I guess I wanted to just kind of revisit Rep. Underwood's comment about the visibility of suffering through fibroids in a when you're in a public role, and invite comments from Dr. Wallace as well. I reflected back, Rep. Underwood, while you were speaking about the past two opportunities that we've had to speak with women in government, which is the state level legislators, and some of them mentioned working from a bathtub for a couple of days because they were bleeding so heavily, and the sessions ran over because there was so much emotion and concern around uterine fibroids and personal experiences. And I know whenever I've been on Capitol Hill, for those without a uterus, I've invited them to speak with the women and menstruators and their families. And when I have an opportunity to speak with them again, they always come back and say they had no idea that there were so many people in such close proximity to them who were suffering. So I guess, Rep. Underwood, I'd like to get your input on just have you had a similar experience like that when you're talking with people in your day-to-day movements? And then, Dr. Wallace, I'd like to um, hear from you regarding um, just the pervasiveness of fibroids in general, and talking about the stigma and how that impacts. So, Rep. Underwood, I'll come to you.
Well, I think what's really challenging for folks to understand it is not just a heavy period. It is like every day, and what it means to be, severely anemic, what it means to have to go in and be inpatient for iron infusions, what it means to structure your day to be able to make it through. Like I used to have to take naps um, very regularly. I had you have to have the stamina to make it through long legislative days. That I had very competitive campaigns, and so I was doing a lot of campaign travel. I was, what I mean. There's just a lot of it's a physically demanding job, and needed to be able to have the physical stamina to make it through. And that was not limited to 4 to 7 days a month when I would be menstruating. And I think that people don't fully appreciate that kind of 365 aspect of living with fibroids. I would also just say that the policy interventions that we are advocating for, not that expensive. They are not controversial. What we are talking about is trying to elevate this on a priority list and trying to say, we just need this done, just handled. You know what I mean? Like, it shouldn't require all of us to tell our deeply personal stories in great detail to our colleagues to get them to just take our word for it and take action. And not to say that I'm unwilling to share, but I don't think that that should be a criteria for getting a markup or getting some floor time, because we prioritize many other things without having that deep, intimate understanding of what our neighbors, friends, family, and colleagues are living through. And so, I am hopeful that with this renewed emphasis, we have some Senate sisters who have really lifted this issue up and have some bipartisan engagement. I'm hopeful that we'll see some movement this Congress as we enter deal making season around the end of the year. But I will just say, the 365 dynamic is something that I think folks just have no clue about.
I agree wholeheartedly. And also, I kind of flip that around because I think we should be revered for what we endure. And I'm very cautious about what language we use, not seeing it as something that we should be there should be some jeopardy for having suffered through this, but that we should be revered, and that there's an opportunity in us thriving, an opportunity for the community at large. So I continue to applaud you for everything and thank you for really emphasizing what a career looks like, and it touches women of all walks of life that are trying to manage those symptoms and manage standing up from a seated position with anemia. Those who have not suffered through it just really have no appreciation for the fortitude that is required to live through that. Dr. Wallace?
Yes, thank you. And thank all of y'all for sharing your stories. It's very important and very impactful. I think one thing, just speaking about the stigma. So we are currently conducting literacy awareness and menstruation and uterine fibroid awareness study that Fibroid Foundation is a partner of, as well as some sites in Florida. But one thing that we are learning is when we talk about the 365, that women who have uterine fibroids, they've been diagnosed with uterine fibroids, that they have not had the opportunity or been exposed to the bulk symptoms and to the anemia into everything to understand and realize that that's part of the uterine fibroid diagnosis, and those are symptoms associated with the uterine fibroids. And so when we talk about that, it is almost like a light bulb going off, and it's so many women who are sharing their stories of, if I would have known that my back was hurting for this reason, and I thought I needed a cane, and just all of these other symptoms that are impacting their everyday lives that no one's ever shared with them, that this is associated with uterine fibroids. So I think that that really impacts how much is known about it, how much is understood, not only for women who are suffering and affected by it, but also by their community and their peers and everyone around them. And another thing really dealing with stigma that we have been very unexpected that we've run into is not all demographics are willing to even share their story or their journey with us. It doesn't matter a demographic that's asking them, but some demographics are not willing to open up at all about anything or to even answer a survey about their experience. So that has been, I think when we look at the Deep South, I think that that is going to be a huge barrier because, as you stated earlier, 70 to 80% of women, doesn't matter your background, your ethnicity, are impacted by uterine fibroids. And we have not been able to get many people who are non-African American to talk about what they've been going through or come up with suggestions or anything. So I think that, and we found that that is a regional issue. So I think dealing with stigma, we still have a long way to go, but I am hopeful that we're going to get there to help increase awareness and be able to help women.
Thank you for that. And while you're, just to kind of follow up on that comment, I learned a lot from you during the Compare UF study about how various medical centers can connect with their patient population to promote engagement and participation in research studies and create a safe space. So, can you talk a little bit about some of the strategies that you utilize or some of the inherent understanding that you have around the patient population at your medical center and what they needed and how to connect with them?
Mm-hmm. Yes, no problem. So again, I will preface this by saying that we are in Jackson, Mississippi. We're in the Deep South. We are in the Bible Belt. So for us, what we have found is our patients, they don't love telehealth. They don't love anything electronic. So options that are preferable are pen and paper, even though it may take longer than us providing an iPad and asking somebody to do that or to scan a QR code. That is not going to necessarily matter. And most recently, we have found that that's true with our 20-year-olds, with our younger generation, as well as women who are up to their early 50s. So for us, our strategies have always been, we have been extremely fortunate to have a long-term health team together. And so I myself personally have been working in this space for almost 30 years at this hospital with this population and have built relationships with women, their daughters, their sisters, their aunts. It's very family-based, very community-based. And I've also been fortunate to have a study team who most of them have been with me for about 15 years. So we have, we text a lot with our participants. We send updates. We try to anything that we can find to send to them or to talk to them about, we do it. Another thing that we also really found is it took a lot getting through the IRB to do this, but if our participants, if they come to us and it can be something that's not about uterine fibroids, but, a transportation issue or something like that, we have been fortunate enough to find ways where our IRB allows us to, be able to refer them to other social needs, even though they're contacting us because they know us through a study. So unfortunately, like here, research is one of the crucial ways in which we're able to help advocate for our patients and to help, expose them to new therapies, things that are not necessarily covered by insurance or Medicaid or Medicare.
Thank you so much for sharing that. And that's a great segue to Natasha. Natasha, can you share a little bit about what recovery really looked like for you? Was there anything that surprised you or that you felt you could have been better prepared for? And following your surgery, was there anything that you noted about how the experience impacted your relationships or your work experience?
I got really lucky, I'd have to say, because my recovery was pretty easy from what I thought I was going to experience. I set myself up thinking it was going to take longer. They had me stay in Singapore for about a week because, I would be traveling, and the doctor wanted me to come back and make sure post-op that I was okay. I just stayed in a hotel and got to relax. So very lucky that the recovery seemed to be good. And after that, we went back and headed back home to the Philippines, where I was able to recover fully and go back to work. And so I have to say it was a pretty easy process for me. And I'm still surprised how easy it was because I didn't have to do like a C-section or any of that with my children. So I was a little afraid, to be honest, when I went into this because I hadn't had any surgeries like this before.
We love a good story.
I know.
That's
It's easy. It's
I
too
can
easy. I don't
appreciate
know.
that because one of the main comments we hear from our community is that there's a fear of
Yeah, I'm
diagnosis,
scared. Yeah.
screening, and treatment. And so I hope that everyone listening to this heard Natasha and is motivated to really be very, aware of their status. Um,
Can I
I'm
share on the other side though?
sure, sure.
Since I'm still looking at hysterectomy, and that is something that I think is holding me back a little bit because I have heard that that takes longer to recover from. So I do want to share that that's my side of the story is that
Mhm.
yes, getting the fibroids is, easier to get done, but I'm holding off on hysterectomy mainly because I've heard it takes 4 to 6 weeks. It's kind of like having a C-section to recover, and that kind of scares me that I would be down for that long because I am active and I'm just like, what would I do? How will I get up and do anything? And it holds me back because of that. So that's the only thing that's really making me not want to proceed with a hysterectomy. So I think that's kind of interesting to think about it that way too.
So I'm happy that you shared that as well because the assumption that hysterectomy is the treatment option that will make everything okay is pervasive in our communities as well. And I'd like to transition that back to Dr. Wallace to just share some talking points on what treatment options are available now at this stage that they weren't previously available and how a patient might go about examining how to move forward with their fibroid care.
Yes, definitely. I will preface that by saying that, of course, not everyone is eligible for every treatment option. You have to take into account your fibroid size, location, number. So there's a lot of factors that can definitely impact the route and the recovery. But yes, hysterectomy is not the only treatment for uterine fibroids. There's uterine artery embolization. There's a lot of women who have been successful with having IUDs, and they have some of them have stories very similar to what Natasha shared. Some of them, they don't have the prolonged bleeding and the pain is lessened. So there are some women who have had some success with myomectomies, and again, they have been able to go 5, 6 years without the fibroids coming back that they are aware of. But so there are definitely other treatments. There's medical options. There's tranexamic acid, which I don't know about everywhere, but I know in some places it's not recommended for whatever reasons or not offered to patients, but it's great at actually reducing the bleeding and helping with the pain. It does not impact the uterine fibroid size, but it's something that you do not have to take every day. I know that a lot of women, they don't want to take oral contraceptives, or they don't want to have to take something every day. So there's also oral contraceptives. So there are more options today, and there's some newer mixed hormonal options than what there were 5 years ago. But again, it's going to depend on where you are, where you live. Like, I can say this, in Mississippi, not all options are available. So it just definitely just going to depend on where you are, what underlying health conditions you have. But the big thing is for women to be aware that there is more than just hysterectomy, and to understand that they don't have to just take their doctors or whoever their provider is word that they have to have a hysterectomy, that they should definitely seek a second opinion, and that there's a lot of different things they can do. And also, I think something that we hear a lot is that some people don't want to have a hysterectomy. I always say, my opinion is that you do what is best for your lifestyle, for your goals, and for your health. And if hysterectomy is that route, then embrace it and try not to have any shame with it.
Thank you, Dr. Wallace. So last question. We've discussed a lot today and gotten some great perspectives. And I'd love to know from each of you, what step do you think would be, or what one or two steps? It's always hard to identify one. But where do you think we should go from here? What would be most impactful to start to really reveal and uncover either treatment options or research or policy around uterine fibroids, considering the enormous 26 million reproductive age women and countless others in the United States who are navigating that perimenopausal, menopausal transition with increased hormones, and managing all of that. And so, Rep. Underwood, I'll come to you first with that question.
Well, thank you. I would encourage folks who care about this issue and want to see some progress to call your representatives and your senators and ask them to co-sponsor the EUIITE Act and the Stephanie Tubbs Jones Fibroid Research and Education Act. Those two bills would make a tremendous difference, and the strength of the voices of the advocates that are part of this community is enormous. Do not believe for 1 second that your phone call, that your meeting request, that your question at a town hall is insignificant, right? Like, we have to make sure that we're taking up space and that we are forcing our elected officials to pay attention to this issue. And the solution is within our reach. We just have to have the political will. It's a decision to get folks to make the decision to pass this legislation and get it done. So I'm optimistic, as I said, that we can do it this year. I'm very excited about the progress that's been made, particularly in the Senate. And I hope that you all will join me in raising your voices and reaching out to your congresspeople and senators. Thank you.
Thank you so much, Congresswoman. I'm 100% on board with that. Dr. Wallace, where would you like to see progression in this space?
I echo what was just said. I fully believe that we have to have change at the policy level in order to move forward. I believe that if we have policy changes, if we can get insurance to cover women being able to have an ultrasound every other year as a part of prevention, I think that that is the best step forward.
Thank you so much. And Natasha, you get the last word. What does progress look like for you in the fibroid space?
I think since I'm all about perimenopause and menopause, it always goes back to education for me. This affected me 8 years ago. I had no idea. I was 36. I thought I was young and healthy and could take on the world. And then all of a sudden I got hit with heavy bleeding and I didn't know what was wrong. And I was just frantic to try to figure it out. And no one seemed to understand what was happening. So I think if I would have had some form of education at that point, I don't even think I knew my mom had fibroids, or my cousin for that matter. So just an open conversations like these, and then education so that women can be prepared and know that this could happen through pamphlets, through education on websites like you have, of course, but just getting it out to younger people. I think that's where it starts.
Thank you all so much. This has been such an incredible conversation, and I know it's moving the needle. And like Rep. Underwood, I remain optimistic. And there's so much power in our individual voices, and this is a great example of that. And I'd like to again thank the Patient-Centered Outcomes Research Institute for making this conversation possible. And I'd like to thank each of you for your time today and your efforts in this space. I hope that our community continues to follow the Fibroid Awareness Month programming for 2026. And please reach out to us at fibroidfoundation.org for any support, questions, and programming information. Thank you all, and